is doing work on protecting disabled children, how nurses and health visitors respond to child protection. She's drawing on relational ethics and ethics of care in her study, looking at relational aspect as well. And her abstract talks about the risk that disabled children are at significantly more likely to experience maltreatment, and she's looking obviously at how professionals react to this as well. So over to you, Ailsa.
Yeah, as Daniela said, I'm Ailsa and I'm a PhD student here at Strathclyde, and so I'm going to be talking through some of my findings from my PhD research on how nurses and health visitors negotiate and respond to child protection issues with disabled children and their families. And so today I'm going to focus particularly on the theme of relationships and relationality, and how they sort of shape the ways in which nurses think about and respond to issues of need, risk and harm. So firstly, just a bit about what we currently know. So we know that, as Daniela said, that disabled children are at significantly increased risk of experiencing abuse and neglect in their non-disabled peers. And we also know from research on professionals' responses that abuse and neglect can often go sort of unrecognised and underreported in the context of disabled children. And so research has highlighted sort of various barriers to suggest why this might be the case. And this is the case for both recognising issues and also escalating issues in terms of child protection as well. So some examples from the literature are issues distinguishing impairment and indicators of risk. So indicators of abuse may be attributed to impairment, a lack of confidence and training among practitioners regarding sort of child protection and disability issues together, perceived communication issues around seeking the views of the child, the perspective of the child, and kind of entering their world in that way, not placing the child at the centre of practice, and also over-empathizing with the child, which is something that's highlighted within this literature. So relationships aren't the sort of centre of this previous research, but there are sort of threads which point to how relationships might influence how professional practice, how practitioners sort of recognise and act on concerns. So it's been highlighted, for example, that empathy with carers and their sort of caring, the sort of demands of caring might increase the difficulty in sort of seeing or discerning cases of abuse and neglect. And so they sort of overlook or sort of underestimate the risks. And so this is sort of a similar pattern. So professionals might have close working relationships with families. This is one quote. It says, witness the levels of demand and subsequent stress associated with caring, see a wee bit of neglect, and so are disinclined to register more formal child protection concerns. And this is similar research in the Northern Irish context. It says making a referral to social services will jeopardise the relationship, and so that slows down the referral rate and raises the threshold. So again, I kind of concern that practice is a bit more sort of parent-centred than child-centred. And here we see sort of relationships and relational capacities, such as empathy, as sort of framed as potential sort of barriers to responding to risk and concerns of abuse and neglect. So on the other hand, what do we know about nurses and health visitors and their child protection practice? So this is focused on sort of their child protection roles and responsibilities with children more broadly. So the kind of individual case of disabled children is underexplored within this literature. And sort of similar concerns are raised around international research, so various international contexts, but concerns around lack of training, sort of various thresholds that are sort of in operation in practice. But this work sort of also highlights that it's a really kind of complex, relationally complex, ethically complex area of practice, and that practitioners experience sort of a lot of tension, sort of moral and ethical tensions as they try to negotiate child protection issues and their responsibilities for child protection. So one example, which is kind of a common thread, is this idea of maintaining therapeutic relationships with families on the one hand, and then surveying them on the other. So that conflict between family support and preventative work, and that sort of more risk-oriented reactive work, so that sort of care and control dynamic. And then also a disillusionment with the broader child protection system. or social work services. So a sense that sometimes their own work might be more helpful, or a sense that the sort of system is sort of ill-suited to meet the needs of the children and families with whom they work. So some of this research really points to the important role of relational practice and how they sort of balance these things, and also in how they can sort of address and tackle issues of safety and how they do that relationally. So we get a sense in this literature of some of the sort of other work that's going on, some of the informal work that might be going on in nurses, nurses and health visitors, sort of everyday work, and how they sort of grapple with these issues in relational ways, that's taking place sort of below the CP, the child protection threshold, sort of at the level of sort of primary or secondary prevention. And so my work is really about bringing these together and exploring how nurses and health visitors respond to issues of risk, need, risk and harm with disabled children and families, and what their sort of practices look like. And they play a sort of really important role as sort of the eyes and the ears, but also along that spectrum of prevention, early intervention, help, an important family support role, and they're also sort of ideally placed, particularly those working in homes and in communities, which is my sample, to sort of respond to these issues of early, that indicate early help and early intervention is needed. And so my research question, my research question is looking at how they negotiate and respond to child protection issues with disabled children in everyday practice. And so to explore this, I conducted semi-structured interviews with a variety of practitioners in Scotland, so community children's nurses, health visitors, learning disability nurses, CAMHS nurses, so predominantly practitioners that have that more sort of long-term sustained relationship with families and communities, and are sort of the practice is more sort of relationship based. And so I've analysed this using thematic and narrative analysis. And so in terms of the theoretical framework, I've drawn heavily on the sort of ethics of care and relational ethics literature, which highlights that the sort of both life and practice is sort of always relational, always contextual, and also it kind of highlights some of the issues around vulnerability and disability in this literature too, and it really sort of centres that as sort of a way of looking at the world and a way of understanding practice. So today I'm going to talk through some of the themes which I think really capture some of the work that I think relationships are doing, that kind of comes across in my interviews, and how they're really kind of at the heart of how practitioners negotiate and respond to issues of need, risk and potential harm with families in the context of disabled children, and really sort of offer an understanding of them as sort of forms of meaningful protective action. So firstly, I think it's just important to highlight that practitioners' relationships with families kind of take place within sort of often vulnerable contexts, so contexts of disablism, which is experienced by both the child but also the family system, and sort of day-to-day struggles. And that's sort of only, my research hasn't taken place in the past year and a half, but that's only exacerbated from what I can see in some of the recent literature around families with disabled children in the COVID context. So just really important to highlight the sort of intersection of structural inequalities that these families and children are facing. And so it's in this sort of context that they sort of try and be helpers and support sort of family life. And so one quote, one practitioner, Mark, he said, there's sometimes an instant acceptance of nursing coming into family homes, trying to make it better. There's always an element of empathizing with the family, seeing how difficult their situation is with particular children. We're not there to make things any more difficult, we're trying to make things better. So a sense here of the importance of, this is something in the literature that's called sort of being in the difficulty. So sort of someone who gets let into family life and sort of sees it all, and also the sense comes across that they're more sort of allied with families and have less of a sort of disciplining function than schools or social work might do. So my second theme is our main tool is, our main tool as nurses is ourselves. And so practitioners' narratives suggest that sort of relationships are really sort of central to how they navigate issues of need and risk, whether sort of big or small, and how they sort of come to be known and how they are responded to as done relationally. So it's within sort of a trusting and therapeutic relationship that they get an understanding of what's going on in family life, and are therefore better able to manage issues of need and sort of ultimately support family life and the child as best they can. So this is a quote by Lily. She says, "I think building up that therapeutic relationship is the easiest way to gather factual information. The more relaxed and confident and trusting someone is, the more they're going to open up and be honest." I'm just looking at time here, I'll be quick. So she says, "The child has obviously got to be the focus because that's who we're there to look after, but the parents need help to manage a situation better. And sometimes you have to say, what can I do to help you, and deal with this first because you'll have the reserve to do this." So they're using relational capacities and skills, so sort of treading lightly, using that soft power to maintain engagement, to both support families and ultimately sort of increase the capacity of families to care for their child. And so we also see what the sort of therapeutic potential of this relationship might be. So practitioners sort of provide a space through listening to families, through a sort of holding environment. So I thought this was a really nice quote. This is in the context of managing pain. Fern said, "When we're speaking to a family, we'll come off the phone and go, actually, we didn't talk about pain at all. We talked about the fact that the family's not slept, our mum's not been well, or they're out of work and there's financial problems, there's housing problems, and you've just been that listening ear. And you've maybe signposted them to go and speak to a service." So again, this sort of environment where the practitioners provide a sort of sense of security, trust, they sort of find out about what some of the issues in sort of day-to-day life that these families might be facing, and can then sort of refer. And also the sort of the importance of the relationship in and of itself as these sort of small forms of action. So listening and responding to families' needs. Which is really important for families feeling supported, particularly mothers who may be really socially isolated, and that's quite a common theme. And so when it comes to raising concerns and sort of challenging parents within the context of issues of risk and harm, it's not to say that it's easy and that they are difficult conversations, but that these are sort of made and kind of are made easier through the foundation of a sort of supportive, trusting relationships with families, particularly mothers. And so it's within these relationships that practitioners can sort of raise concerns in sort of sensitive ways. So one practitioner, Beth, said, "It's okay to say this is going to be a difficult conversation. I don't want to upset you. It's quite an emotional time, but hopefully we'll reach some resolve that you're happy with and things are going to be easier. And the outcome is going to be that the child gets to school, the child's getting a wash every day." Things like that can be difficult, but it always needs to be that you try and get the parents on board. And so, yeah, just this sense that having that relationship can make things easier. That's the sort of second quote from Susan there. So relationships as sort of opening this space for talking things through and for openness. And so some of this difficult work around protecting disabled children through supporting families, I think, can sometimes only be done because and through these sort of good relationships which are relational. And which involve sort of relational capacities. And so they can sort of balance their sort of supportive ethic towards families while simultaneously protecting the disabled child. And so I've sort of conceptualized this in terms of sort of trying to understand what sort of meanings, what is their model of protection, what is the kind of work of protection, and how can we conceptualize that? So I've conceptualized this in terms of a relational ethic of protection in practitioners' everyday practices with families and how they respond to issues of need and risk. And this is at the sort of low level and that sort of slow work of letting families vent, nudging them, maybe helping them think about the bigger picture. But also this relational ethic is also at work in how they deal with quite hard issues and quite sometimes complex issues of risk. So along that spectrum of sort of need to harm, that they're sort of embedded in this sort of relational work. And so these relationships and relational capacities can both entail and enable action. So thinking about it in terms of these sort of active work, which is embedded in relationships, as opposed to being a barrier to protecting children, it's about understanding that in a more positive way that really captures that sort of grounded protective work that goes on in sort of day-to-day practice with these families and within the sort of context in which they live. So yeah, I'll just end there because we're
Great, excellent.